Hi, my name is Kaitlyn Dickson, and I'm a medical student at Robert Wood Johnson Medical School. And my presentation today is on the long-term outcomes of sonographically guided intrauterine device placement. So we looked at the continuation rates of IUDs that have been placed using ultrasound guidance. I'm a student, so I have nothing to disclose. Just a little bit of background on the topic. IUDs are used on average by 23% of women worldwide and 10.3% of women here in the United States. Risk of expulsion of IUDs is associated with a patient's age, their history of previous IUD expulsion in the past, uterine fibroids, and nulliparity. So right now, transabdominal guided ultrasound is used in the clinic for potentially difficult insertions. So just a little bit more background. The use of ultrasound-guided IUD placement has been shown to be more successful than traditional placement. You see lower rates of expulsion due to being able to see where you're actually placing the IUD within the uterus. IUDs have also been used, along with their known use of contraception, for the treatment of abnormal uterine bleeding, which may occur for an unknown idiopathic reason or from uterine fibroids, which may cause that abnormal bleeding. The presence of fibroids correlates to higher rates of IUD expulsion or malposition, and those are some of the things that we use to guide our data collection and measurements. So to date, there are no studies that examine the continuation rates of IUDs that have been placed using ultrasound guidance, so that's what we sought to do here. So the methods used for this study, we used a retrospective chart review of all of the patients in clinic who had had an ultrasound-guided IUD placement from the years of 2012 to 2018 to determine their rates of expulsion or removal. It was a total of 136 patients. However, 20 patients were lost to follow-up, which left us with a total of 116 patients total. Their continuation in days, as well as their reason for why the IUD was either expulsed or removed, their age, BMI, the presence of fibroids, indication for why an ultrasound was used, as well as why the IUD was placed to begin with, were also recorded. And then we calculated a ratio based on their actual to expected use, and that was based on the 5-year expiration and removal suggestion that's put in place now. And then we looked at the days that their IUD was actually in place to come up with that calculation. So just to continue with the methods, the IUDs that were no longer in place we categorized by the reason for why they were no longer in place. So, for example, whether or not it was displaced, if it had spontaneously been expulsed. A lot of patients had unwanted side effects, and that was their reason for asking to remove it. Some patients had surgery, or patients wanted to become pregnant, and we removed it for that reason, and all of that was looked at. And then patients were divided based on those other characteristics, including fibroids, BMI, age. And we created Kaplan-Meier survival curves with the help of a statistician, and we separated those based on relevant variables. So for our results, the overall actual to expected ratio was calculated for every single patient in the study based on that 5-year expected use and was found to be 63.49%. And this statistic means that approximately the IUDs were in place for 3.2 years on average, which is a pretty significant finding. So discontinued IUDs were then further classified by their reasons for expulsion or removal, and then I showed all of these reasons in the pie chart. So the number one reason was spontaneous expulsion, which is here in blue. That accounted for 25.5% of all of the IUDs that were removed or expulsed. And that was 11.2% of all total patients, which was 13 patients. And of those 13 patients, 5 had uterine fibroids. Then the next most common reason was unwanted side effects, and then displacement, surgical removal, and failure to alleviate symptoms were all tied for the third most common reasons at 11.7% of the discontinued IUDs. So this is our first Kaplan-Meier survival curve, which shows the plot of all patients that were involved in the study. The blue line is your 5-year marker, and then the confidence interval is plotted above and below that middle line. So you can see that there's a pretty steady decline in the first year, and then it kind of flattens out. and then there's another drop right around the 3rd year, which flattens again. The overall continuation rates, however, are still pretty low at that 5-year marker, which correlates to the actual expected ratio that we got in our study in general. So the first graph's a little bit complicated, so I won't make you look too much at that. But this is our survival curves that were based on relation to BMI, and the first one separates out all of the specific classes of BMI, underweight, normal, overweight, and then all 3 classes of obesity. In the second graph, we made it a little bit easier to read. So this black line here is the underweight people. We only had 2, so no conclusions can be drawn about that subgroup. Normal is in red, and then we categorized all overweight and obese classes together, and we put them all in one line, which can be seen in green. So you can see that the red line is significantly higher than the green line, which indicates that those of a normal BMI had higher continuation rates just in general. So I have some statistics on the next slide, so I'll go to that. The actual expected use ratios for all of the categories. So like I said, normal had highest continuation, and that rate was 78.2%. The overweight actually had the lowest rates at 45.87%. And obese, all of the classes together had 60.5% about. And again, like I said, the underweight patients, there were only 2. So we would need more patients to draw conclusions about that. Our last Kaplan-Meier curve here is based on the presence of fibroids in the uterus. So we plotted a fibroid uterus versus a non-fibroid uterus, and the non-fibroid uterus is the red line, and the fibroid uterus is black. And again, our green line here is the 5-year marker. So you can see that there's a pretty significant difference between the presence of fibroids, and the fibroid uterus, which is in black, is significantly lower survival rates than the non-fibroid uterus, which correlates to the actual to expected use ratio that we calculated for both here at the bottom. The fibroid uterus was found to be only 43%, which is significantly lower than the non-fibroid uterus, which was at 73.8%. And we found that statistic to be statistically significant. We then looked at rapid expulsion, which we defined as any discontinued IUD for less than 90 days. Within the first 30 days, 5 patients, which is 4.3% of the patients, had their IUDs removed for one reason or another. Within 60 days, the total went up to 8, and 90 it went up to 10. So 8.6% of the patients had their IUDs removed within the first 90 days, which is pretty significant, which is why that overall Kaplan-Meier curve had such a significant drop in that first year. Of the 10 patients that were displaced or removed within the first 90 days, spontaneous expulsion accounted for 4 of them, and displacement accounted for another 3. So displacement or spontaneous expulsion accounted for 7 out of those 10, which is a significant portion. And then, like I said at the beginning, we looked at why IUDs were placed in general, whether it was because of fibroids, contraception, abnormal uterine bleeding, and we examined whether or not that had an effect on whether or not the IUD was in place for greater than 1 year or less than 1 year. And specifically, you can see in the last 2 columns that the fibroid uterus was retained for less than 1 year more frequently. And then when you look at contraception in comparison, the numbers are almost reversed. So when people were coming in to have IUDs placed for the reasons of contraception as opposed to maybe symptom management for fibroids, their IUDs were staying in a lot longer. And overall, there was a 74.04 12-month continuation rate. So like I said at the beginning, we looked at the reasons why people got ultrasound guidance to begin with, because it's not standard on a first placement to receive ultrasound guidance unless there's a reason to. So common reasons for getting ultrasound guidance include an abnormal uterine anatomy or pathology that is known to exist, a prior failed office attempt, previous IUD expulsions, a previous procedure or IUD removal that had occurred with that patient, or other indications like obesity or an embedded IUD arm. And I just have the statistics of how many patients followed each of those subgroups listed. But I highlighted previous IUD expulsion because when we further looked into that subgroup, we found that 18 patients total had an IUD placed using ultrasound for that reason of an expulsion in the past. And of those 18 patients, a third of them experienced a second spontaneous expulsion. And no other indication that I have listed above had a significant percentage of patients that later suffered a spontaneous expulsion. So that definitely indicates that those patients might be at a higher risk for a spontaneous expulsion. So this is just a recap because there were a lot of statistics in this presentation. So we found that BMI was significant in that the lowest continuation rates and actual expected ratios were both found in the overweight subgroup. The normal BMI corresponded to the highest rates of continuation, so it seemed to be protective in that sense. Despite using ultrasound guidance, fibroids still appeared to be a problem in this population, and the rate of expulsion was still much higher among those patients that did have uterine fibroids, which was seen pretty clearly in that Kaplan-Meier survival curve. And then previous expulsion, which occurred in 18 patients who underwent the procedure due to a previous expulsion, a third of those had a subsequent following expulsion using ultrasound guidance. So that subgroup also appeared to have higher rates of risk. So overall, of all the IUDs that were placed and discontinued early, the actual expected use ratio was calculated to be 34.04. So of all the ones that were no longer in place, on average, they were only in place for a third of their expected 5-year use, which is the equivalent of about 20 months. And just to reiterate that uterine fibroids, BMI, and a previous expulsion appear to be the most likely predictors for IUD discontinuation. So these groups really require further attention to determine the etiology of their expulsion, and also the risk, benefit, and cost efficiency need to be carefully evaluated to determine if this is still the most effective practice for them. So thank you so much. It was an honor to talk to you here today, and I hope you enjoyed the presentation.